Minutes past, so I think we're just going to get started. Thank you so much for everyone that's joined or anyone joining now as we start. I'm Sophie. I'm Senior Client Success Manager with Apricity, and I'm also going to be I'm helping host this presentation and then to run through these slides and answer all the questions in really amazing clinical insight is going to be Debs McGuire, who's joining me today. So I'm going to hand over to her to introduce herself properly and get on with the presentation in a moment. But just for the time being, a reminder that any questions you have, please pop them in the Q&A function. And if you are one of those people who's already popped in a question before the call, we're going to cover that at the end. And then we'll also send you a little bit of wording in a reply as well if you're not able to make it. So we'll cover those at the very end as well. But yeah, any questions as we go, Q&A, and then we'll have plenty of time at the end to get through them. So without any further ado, I will hand over to Deborah McGuire, our Senior Fertility Nurse, to introduce and take us over.
Thanks, Sophie. Hi, everyone. Yeah, I'm Debs. I'm one of the senior fertility nurses at Apricity. I've been a fertility nurse for about 15 years. And I've worked in all different settings, like in NHS clinics, private clinics, and now with Apricity as well. With that comes experience of working with people with fertility issues of all different sources, backgrounds, including PCOS. So I'm really excited to be able to do this presentation this evening just to help you guys understand a little bit more about PCOS and what that means for you, or perhaps if it's a friend or a colleague or a loved one, hopefully we can provide some more information on PCOS as well. And as Sophie said, if you've got any questions, like please just pop them in a Q&A and we'll get plenty of time at the end to answer any questions as well. So yeah, thanks so much for joining. Great. So I've already covered this a little bit, but what we'll be covering in the webinar is really just, first of all, understanding what is PCOS, what are the symptoms of PCOS, how is it diagnosed, how PCOS impacts your fertility. We'll also have a look at the mental health aspect and impact of PCOS as well. And then finally, just wrapping up with how to support someone with PCOS. So again, if you're on this webinar or you joined because you want to support a friend, colleague, or loved one, hopefully we'll be able to answer some questions and give you some hints and tips on that. Also, as we go throughout this presentation as well, we're just going to hopefully bust a few myths on PCOS. So here's a few that we're going to kind of just make note of at the start, and then we'll revisit them at the end just to make sure that no stone is left unturned. So first of all, we're going to look at, do women with PCOS have ovarian cysts? So is it the case that every woman with PCOS has cysts on their ovaries? Is it true that people with PCOS cannot have children? Does having irregular periods mean that you have PCOS? Is PCOS a rare condition? And this one comes up a lot actually. Will losing weight get rid of PCOS? So hopefully we can work through these questions and you'll feel a bit more informed at the end of the webinar as well. So starting off then, what is PCOS? So PCOS stands for polycystic ovarian syndrome, and it's a name given to a condition which affects the way in which a female's ovaries work. So typically, what helps to regulate our hormones and our menstrual cycle is the healthy conversation between our pituitary gland and our ovaries. And when there's any dysregulation with those hormone balances, then it can affect our periods and our menstrual cycle. And that can be one of the contributing factors to PCOS. So PCOS affects about 1 in 10 women. However, we don't know how accurate this statistic is because there's a wide spectrum of symptoms and how PCOS presents in women. And also it's quite difficult for PCOS to actually be formally diagnosed. So it's likely that more than 1 in 10 women are affected by PCOS. And this is really important actually to note that PCOS, it does stand for polycystic ovarian syndrome. So it's not actually a disease, but it's a more of a collection of symptoms, which is what defines the syndrome itself. So within that, you'll get a variety of how the condition presents because symptoms vary from person to person. So I think that's a really important note that what you're experiencing, it may be more or less than somebody else who may also have a diagnosis of PCOS, but it doesn't take away from the fact that, you know, you have that diagnosis and you still need support potentially. It's just different for each person. So how is PCOS diagnosed? So I mentioned that it is quite difficult to get a formal diagnosis of PCOS, mostly because it can be difficult to like battle with NHS, like waiting times or getting to see your GP and really being heard and listened to about your menstrual symptoms. Um, but in terms of the actual being diagnosed, there's a criteria called the Rotterdam criteria, and you have to meet 2 out of the 3 of these clinical features to have a formal diagnosis of PCOS. So that can be either having irregular or missing periods. An irregular period is generally defined when you have 8 or less periods per year. Or having a menstrual cycle that lasts longer than 35 days. So when we think about the length of your menstrual cycle, it's not how long you bleed, because I think some people think that's how long their period is, but it's actually from day 1 of your period until day 1 of your next period. So if that is longer than 35 days, then that's what we tend to class as being irregular. And it would be having cycles like that more like frequently rather than just an odd cycle that is slightly longer, because that can be quite normal. The second diagnostic criteria is having excess male androgens. Now, this sounds a bit complicated, but it basically just means that there's excess male hormones that are elevated in your blood profile tests. And that can cause symptoms like excess body hair or excess facial hair. It can also cause like male pattern baldness, and also some people with PCOS have like cystic acne, so breakouts along the jawline, and they can really struggle with acne as well. And then the final diagnostic criteria for PCOS is having cysts on the ovaries. Now, it's important to note that they're not actually cysts. I think when we think of a cyst, it's something that's like filled with pus and not particularly nice, whereas actually on the ovaries, what we mean by cysts is that there's actually more than average a more than average number of immature follicles on the ovaries, and follicles are what are produced by the ovaries that then help an egg to mature and develop. So generally the criteria is having 12 or more follicles on one ovary or both ovaries. So if you have 2 of these criteria, then you meet the criteria to be diagnosed with PCOS. And just to make it even more complicated, there's not just one type of PCOS. Unfortunately, there's 4 types, which hopefully just gives you an idea of the wide variety of how PCOS presents, but also how it affects a person as well. So I think it's really important that if you are thinking that you might have PCOS, or someone you know may have PCOS, it would be good to definitely get some diagnostic tests so that you can really get a grip and a grasp on your own health and understand what that means for you, because the symptoms are very different for each person. So I'll touch on these types briefly, but there are some more links that we'll reference at the end of the webinar as well, so you can go back and read them, because sometimes you need to read things on your own and kind of think, okay, is this relevant to me? But I'm also more than happy to answer any questions as well afterwards, or on a separate call if that would be helpful. So type A PCOS is what we call full-blown PCOS, which sounds quite intense, but it means that you're hitting all those the criteria that we just spoke about. So issues with ovulation, so that can be having regular periods but not ovulating, so that could present as issues getting pregnant, or difficulty getting pregnant. It could be irregular periods, or just an absence of periods altogether. High levels of androgens, so that can be presented as like the male pattern baldness that we spoke about, acne, or like thicker facial hair growth, and also then the presence of lots of follicles on the ovaries, which are commonly known as cysts. Then we've got type B PCOS, which is non-PCO PCOS. So PCO means polycystic ovaries, and then PCOS is polycystic ovarian syndrome. So with PCO, you have the ovaries that present with lots of follicles, but you don't have the syndrome that's associated with it. So type B can present as having ovulatory issues sometimes, but not always. And then some people will also experience those high levels of androgens, giving you like increased facial hair, acne, etc. Type C, ovulatory PCOS. So you can probably work out the missing link here. It's like one of those puzzles with what's missing. But with type C PCOS, You can have the high levels of follicles on the ovaries, so higher levels of cysts on the ovaries, but still have regular periods and no issues with ovulation, hence the ovulatory PCOS. But you can experience those higher levels of androgens as well. So you can have some of those physical characteristics that are commonly associated with PCOS. And then the final type is type D, so non-hyperandrogenic PCOS, which basically means that you can have the ovulatory issues associated with PCOS, so irregular periods or missing periods. You can have the high number of follicles in the ovaries, but you don't have those higher levels of androgens within your blood profile, so you don't necessarily display those physical symptoms. So yeah, that just gives you a breakdown of the 4 different types of PCOS. And again, if you're kind of unsure if you meet any of those criteria, again, more than happy to answer any questions, or I think we're going to share the link where you can book a complimentary call with myself or one of my colleagues at a time that's convenient for you as well. Next slide, please, Sophie. So what causes PCOS? So it's still under research. We never know exactly what will cause and trigger PCOS in each individual, but we know that often there's a combination or there's more common features that we see in people who have PCOS. So one of the first things that can contribute to PCOS is an imbalance in your hormones. So higher levels of male hormones called androgens, which we touched on earlier, those raised levels can cause an interference with ovulation, a menstrual cycle, and that can cause the presence of more follicles on the ovaries, and it can also cause issues with ovulation. Those raised androgen levels, as well as we mentioned, also can cause the physical characteristics, sometimes such as acne, hair growth, etc. You might have heard of insulin resistance. So this is when the body becomes less sensitive to insulin, and insulin is a hormone that's produced by your pancreas, and it helps you to break down your food and regulate your blood sugar levels as well. So some research believe that this excess in insulin means that the body overproduces those androgen hormones. So it's thought that insulin resistance can be a contributing factor to those hormone levels becoming slightly deranged within people with PCOS. And then the final contributing factor that we're going to talk about is genetics. So whilst it's not 100% guaranteed if your mum or someone else in your family has PCOS that you will have it, what we know is that it does tend to run in families. So if someone in your family has PCOS, it might be worth getting some tests done just to check to see if you do display any of the symptoms, whether that's blood profile or number of follicles on your ovaries, because as we've already discussed, like PCOS can present in a variety of different ways. And just because there may be a genetic link and someone in your family may have PCOS, they could be presenting quite differently with the syndrome as well. So it could be that they have regular periods, but no external symptoms. Well, they have the external symptoms, but have the regular periods. So it could be different for each person. So it's really important to get yourself checked out so that you can be a bit more empowered about your own reproductive health and your own fertility as well. Next slide, please, Sophie. Thanks. So I've talked a lot about the symptoms of PCOS already, but what I would say is that this isn't an exhaustive list, and lots of people will have other symptoms, and they'll be on a spectrum as well. So as we said, irregular periods are really common in women with PCOS. And that can be periods, like we said, less than 8 menstrual cycles per year, or it can be just having no menstrual cycle at all. Or it can be a pattern of perhaps having a couple of regular cycles and then maybe having like a 40-day or a 50-day cycle for a couple of months and then changing back to regular. So, yeah, it's not necessarily that consistent pattern that you would expect to see. Associated with that and the hormone imbalances, people with PCOS can experience more mood swings or can find it more difficult to manage their kind of mood as well. Interestingly, people with PCOS tend to have more skin tags, so that can be a common feature to look out for. Associated with the irregular periods can be difficulty getting pregnant, but again, it's important to know that you could have regular cycles but have issues with ovulation, so that in turn could make it difficult to get pregnant without necessarily having the obvious lack of periods themselves. Because of the insulin resistance, PCOS is often linked with weight gain. So that inability to control and regulate your blood sugar is associated with weight gain and that kind of pre-diabetic state. We talked about the excess body hair that can be seen. So that can be facial hair, or it can be thicker hair on the arms and legs as well. And that's associated with the higher androgen levels in your blood. Some people with PCOS experience greater pelvic pain, not everybody. So I think I think pelvic pain is often more associated with endometriosis, but PCOS can cause pain in itself as well. Um, Acne is also a common feature of PCOS, and again, it's linked to those hormone imbalances. And some people do note some skin darkening as well with PCOS. So again, this isn't a list that you have to tick all of the symptoms to kind of think that you have PCOS, but if you're identifying with any of those symptoms and you've got any questions, definitely worth having some tests or speaking to someone in some more detail if you've got any concerns. So now we'll just delve into a little bit more detail on how PCOS can affect the menstrual cycle. So again, we talked about the irregular periods, so defined as having 8 or less menstrual cycles in a 12 calendar month, or having a cycle that lasts longer than 35 days, remembering that it's not just the length of your bleed, but going from day one of your period until day one of the next period. And then we've got a range of other symptoms and how the menstrual cycle is affected by PCOS. So for some people with PCOS, they can have very irregular bleeding. So when they do eventually have a period, that period can be really heavy, and it can last much longer than like the 5 to 7 days that you would expect your menstrual cycle to last. So if you are having a period that lasts longer than 7 days, or you're having to change a pad like more than once an hour, or you're passing large clots, then I would definitely reach out and get some diagnostic tests done, because that can be a symptom of PCOS, and how it presents and affects the menstrual cycle. On the flip side of that, you can have no bleeding at all. So often what happens is if you're having regular ovulation, then that encourages the lining of the womb to thicken, and then shed each month. But if you're not reaching that ovulatory stage within your cycle, then the lining of the womb isn't actually thickening. So then when you do potentially have a period, it's very, very light because the lining of the womb has just kind of broken down over that time and there isn't anything to shed. So sometimes it can present as just no bleeding or very light spotting, but not actual physical bleed. Um, and sometimes people with PCOS do experience more severe period pain. And those pains can really interfere with like activities of daily life, and it can mean that you're perhaps like off work for a couple of days, requiring more regular pain relief. And yeah, we can definitely provide some like hints, tips, and resources to help you manage the pain relief effectively too. Thanks, Sophie. Next slide. So the next slide here, we're just going to touch a little bit on how PCOS can impact fertility. And again, if you've got specific questions about your like fertility with PCOS or how it might be impacted, I definitely encourage you to reach out, like ask any questions, or feel free to email me or book in a call afterwards if you've got anything specific that you want to go through. But PCOS can impact fertility and it can cause problems in pregnancy. I would say that just because you have PCOS, that doesn't automatically mean that you're going to have issues with fertility. As I say, it's a spectrum of how PCOS presents. So some people with PCOS, even if they have irregular periods, if you're tracking your periods like with an app or with a wearable device, or tracking your body temperature, those kind of things, or doing ovulation tests, it can help you to get the like timed intercourse correct. And lots of people with PCOS conceive with no problems and without any assisted like technology to support their reproduction. However, what we do know is that because of how PCOS presents and it affects ovulation, and someone having regular menstrual cycles, it can generally take women with PCOS longer to get pregnant. So there are a few options out there for you, and we'll talk a little bit about them in detail now. But if you do have specific questions, feel free, and I'm more than happy to talk through these processes in more detail. So egg freezing is one of the first things that we think about when it comes to PCOS, because whilst you may not be at the stage of your life when you're wanting to actively have children, regardless of whether you have PCOS or not, any woman her ability to get pregnant naturally declines with age, and it's just a natural part of the aging process that is slightly out of our control. There are lifestyle traits and habits that can negatively affect our fertility, such as like smoking, drug use, alcohol, but then also thinking about, if you had to go through chemotherapy or some surgery that may damage the ovaries, that can have a longer term impact on your overall fertility and egg quality. Um, but freezing your eggs can actually help preserve the egg quality. So, say if you freeze your eggs when you're like in your late 20s, and then you come to use those eggs in like your mid to late 30s, your chance of getting pregnant is the age you were when you froze your eggs, because we're preserving the DNA quality of those egg cells. Um, and egg freezing can be a really viable option because if you know that you have PCOS, and you also know that you maybe want more than one child, it could be that, say, if you're, trying to get pregnant at 30, not too much of a problem, but actually when you're ready to have your second child, that could be much later into your 30s when your natural fertility has taken a decline as well. So again, we're preserving the egg quality and increasing your chance of having a healthy pregnancy. Um, If you've been trying for a while and you know you have PCOS, then other options could be IUI or IVF. So these are the more commonly known like fertility treatments that you may have heard of. Now, obviously it depends on your personal situation, whether or not you have a partner, if you're in a same-sex relationship, if you're single. Um, Regardless, both of these treatment options require a semen analysis, or if you're using donor sperm, we would need to support you and make sure that that's the right treatment for you. So, for example, with IUI, you would need to still have similar medications that are associated with IVF to control the ovulation. So, this is where it can really help to support people with PCOS who don't ovulate on their own. So, the medications can either be oral tablets or injections to stimulate the ovaries to produce follicles at the correct time. So it's a little bit more controlled than a natural cycle as such. And then with IUI, the sperm is inseminated. That sounds awful, doesn't it? It's inseminated into the womb through the cervix to then reach the egg, which is also timed with ovulation through medications too. Um, to have IUI, you need to have patent fallopian tubes as well. So sometimes we'll recommend a test to check the fallopian tubes as well. Or if you've had surgery or a tube removed in the past, IUI wouldn't be the treatment for you. So in that instance, IVF would be the best option for you. So with IVF, it's similar in that it's controlling and stimulating the ovaries with medication. Um, the medications are a higher dose because with IUI, we generally want 1 or 2 eggs to be released. Any more than that puts you at a high risk of a multiple pregnancy. Whereas with IVF, we want to collect a healthy number of eggs, which are then removed from your ovaries. And it's a minor surgical procedure that's called an egg collection, a novel name. But then the eggs are collected and they're mixed with the sperm in a fertility lab. And then we use the lab to culture, well, to support the eggs fertilizing to create embryos. And then the best developmentally looking embryo is transferred back into your womb to give you one healthy pregnancy, hopefully. And any remaining embryos are frozen and stored for future use. So again, IVF can still be a really helpful option for preserving your fertility because any leftover embryos can be used for a future pregnancy as well. And I guess the difference between IUI and IVF is that you're creating all of those embryos in one go, whereas with IUI, you're aiming to create one pregnancy at a time, and you're not preserving any fertility. And then the other option is ovulation induction. And I perhaps should have spoken about this earlier in the timeline because ovulation induction is often the first line of treatment for someone with ovulation issues and PCOS. So with ovulation induction, this is very hands off really from in terms of a clinical treatment. So ovulation induction is where you would take oral medication, so just tablets. You generally take them for about 5 days at the start of your period. And if you don't have periods, it's not too much of a problem. We can give you medication to induce a bleed so that we know where you're at in your cycle. So if you're one of those people that only has like 1 or 2 periods a year, it's not too much of an issue. We've got ways to ensure that you're taking the medication safely and at the right stage for you. So the aim of the ovulation induction medication is that it stimulates the ovaries, but again, similar to IUI in that we're only really wanting one or two follicles to grow and develop to produce a mature egg, because we don't want to put you at risk of a multiple pregnancy, which carries risk of miscarriage or complications. Um, so you take the medications at home, and then you would attend a scan clinic to have your ovaries monitored. So you would have one or two transvaginal ultrasound scans to monitor how your ovaries are responding to the medication. And then you'd be sent home to have timed intercourse at the right time. So it's really important if you do have ovulation induction as an option, that you're being monitored really closely by a clinic, because without those ultrasound scans, some women can really over respond to the ovulation induction medication. And if that's the case, that again puts you at a risk of a multiple pregnancy. Sometimes if you're releasing 3 or 4 eggs, that can be really dangerous. So if that's the case, it's maybe not the medication or the treatment option for you. So at Apricity, we do offer a fertility benefit, and some of you may have joined because you have that benefit through your employer and your workplace. So if that's something that you wanted to explore, we'll include the link below, or at the end of the webinar actually, so that you can book in a free call and you can find out more information about your benefit through us. So myself and my colleague Gemma can help support you with that. Next slide, please, Sophie. So we talked a little bit about the importance of having some diagnostic tests to help you understand if you do suffer with PCOS. So this just gives you an overview of what those tests may look like. It's not necessarily what every person would have, but it's different for each individual. So a medical history check is really important. So a doctor would have a consultation with you. They'd look at your medical history, any previous conditions that you've had, what's the trait and trends in your family as well, to look at, okay, just getting an overall view of you as an individual. Sometimes the diagnosis can involve a physical exam. So that can be just like looking at acne, observing hair patterns, hair loss patterns as well. I mentioned before, so a transvaginal ultrasound scan. So that's an internal scan which allows us to closely look at the ovaries, count the number of follicles that are on the ovaries as well. So do you meet that Rotterdam criteria? Do you have more than 12 follicles on one or both ovaries? Are there any large cysts present? It also allows us to have a look at the structure and shape of the womb as well, and see, is there anything that might be causing any issues with you conceiving as well? And again, it allows us to look at the thickness of the lining of the womb as well. Alongside of those 3 prior tests, then we would also do some blood tests as well to check your overall hormone profile, but also to check out those levels of the androgen hormones as well, so those male hormones as well, see if they're within the normal range. Next slide, please, Sophie. And then just touching on, because we've talked a lot about the physical symptoms and how it presents and what you can expect with PCOS, but I think sometimes it can be really overlooked how PCOS may affect someone's mental health. So here's some really interesting facts. And yeah, if anyone has any more questions on the mental health side and impact of PCOS, I'd be more than happy to answer them. Or if you wanted to talk about them and get some support, again, we've got resources at the end, or happy to talk. So people who've been diagnosed with PCOS are 3 times more likely to be diagnosed with anxiety and depression than someone who doesn't have PCOS. People with PCOS also tend to experience more severe symptoms of anxiety and depression. We spoke a lot about the physical side effects, so the acne, hair growth as well, and that can really affect someone's self-esteem, their self-confidence, and that can make them, feel unattractive, less desirable, really less confident as well. I think the impact on fertility that's can be associated with PCOS can often cause a lot of distress, particularly around peer pressure or family members perhaps asking, when are you having children? Time's ticking, those kind of things, or just being around peers who are perhaps seemingly able to get pregnant very easily without any issues. That can cause a lot of distress. And then also, again, thinking about cultural society norms as well, and again, that kind of links into that classic age when you should be having children and ticking those boxes as well. So I think it's just being mindful of how PCOS can have a wider impact, not just as a physical syndrome. So whether that's yourself, or if you're living with someone with PCOS, or you work with someone with PCOS, I think it's just about being mindful of the wider impact that it can have. Next slide, please. So, how to manage these symptoms once you've been diagnosed? So, whilst there's no definitive cure for PCOS, we know that people can get great relief from their symptoms by different lifestyle factors and kind of introducing different things that may help manage their symptoms. Again, it's very different for each individual person. So, again, it's not an exhaustive list, but there might be some hints and tips in here that you may find helpful. So, first of all, stress management. Stress and hormones are really closely related, which, you sometimes when we're stressed, like some people will get ill, but for others, they may miss a period or their period may be late by a couple of days. So it's really interesting to look at that relationship between stress and how stress affects you as an individual. Um, Whilst work and life are always really busy, and then juggling a social life and everything else on top of that, finding just 5-minute mindful breaks in your day can be really helpful, because feeling stressed isn't necessarily bad, but being able to recover and reset your nervous system after those stressful times is actually really beneficial for your overall hormone health. Um, Eating a balanced diet is really helpful for overall hormone health, but particularly with PCOS as well. I'll touch on some resources at the end that have some really good nutritional guidance for people with PCOS. Again, it's different for each person, so there's never going to be one prescriptive diet that's going to fit each person, but I think it's experimenting, seeing how different foods, different diets, different lifestyle changes affect you as an individual. Is it better? Is it worse? Then it gives you an idea of what's going to fit you best. Monitoring your symptoms is really beneficial. So this could be through like a menstrual cycle tracking app, or like a wearable device that monitors your sleep, your heart rate. Are you getting enough sleep? Or if you're not, is that contributing to your stress? So, and on those times when you're more stressed, does that make your cycles more irregular, or do you get more pain? So it's interesting to monitor those symptoms, and are there any patterns that you can track for yourself? Sometimes medication is required for people with PCOS. So sometimes that's contraceptives to help regulate symptoms and regulate bleeds. It can be different medication to help with the insulin resistance side of things and to assist with the weight loss. But also thinking about supplements like vitamin D can support your overall hormone health. Folic acid is also really important for any woman of reproductive age to be taking. Um, Alongside of this, maintaining a healthy weight, it can be really difficult, especially with PCOS. We know that insulin resistance can make it very difficult to lose weight, even if you seem to be like eating less than other people and it doesn't seem fair. Unfortunately, it's one of those things that is connected. But again, we've got some really good resources that I can send across, or that you can access at the end of the webinar to help with weight management. I think it's difficult as well, because then when you're struggling with weight loss, that can really affect your self-esteem as well. So it's thinking about things that you can do to tap into, perhaps stress management, managing your mood to keep you positive and to keep you on the right track. And I think alongside of this, then support groups and counselling have a really valuable role. So like we said, at least 1 in 10 women suffer with PCOS. So you're not the only person. In fact, that like there's all of you here tonight, that just tells us that there are people out there who really need support and guidance with PCOS. But we'll include some link to support groups that you can access, and they can be online, so they're a bit more anonymous, but there are also in-person support groups as well that you can access. And I think it's also important to not underestimate the role of counselling, and it doesn't necessarily have to be that the counsellor will solve the PCOS, but perhaps looking into and exploring those, societal pressures that you may feel from like fertility issues associated with PCOS, or the self-esteem side of things. So definitely, I think managing and approaching it from like a holistic perspective is really, really important. Next slide, please, Sophie. And yeah, we touched a little bit on these things, but I think just to formalize like how technology can actually really help you with PCOS. Like I know sometimes we're like glued to our phones, and that can be counterproductive, but actually technology is there to help us. And when used in the right way, it can be really beneficial in empowering you to understand what's going on in your body. So menstrual tracking apps. So I think your Apple Watch can do this. So like you can track it in many different ways. Some people just like to track their cycle or their symptoms on a calendar, in a notebook. That can be a really nice way of doing it. But tracking your cycle can be really helpful to notice, okay, what did I feel around ovulation, or what did I feel like at this stage of the month? And even if your cycles are irregular, sometimes if you track regularly, you can start to notice little patterns coming through. Um, Fertility treatment can be required, and it can be a very helpful form of technology. Again, we've talked a little bit about the different treatments. And similarly, wearable technology can be really helpful in a way, particularly for like monitoring like heart rate variability or sleep quality. Those things can really impact our hormones, which in turn can affect like menstrual cycle as well. So they're not necessarily things that you would be able to physically track yourself without having that extra information. So they can be really helpful. Next slide, please. Great. So, just kind of thinking about how to support someone with PCOS. So, that could be a partner or a friend or a colleague. So, informing yourself on PCOS, the symptoms, being aware of the challenges that someone with PCOS may face, and just trying to understand, having that empathy of what they're going through. Where possible, if they're like trying a new diet or they're trying to make healthy changes, see if you can join in with them. So sometimes when you're doing things on your own, it's really hard. And especially if you feel like you're the only person doing it, you can feel like the odd one out. And rather than perhaps saying like, oh, why are you doing this? It could be like, oh, great, I'd love to try that diet, or I'd love to start going for lunchtime walks. Can we do it together? Or can we go for evening walks? Like it would be, I'd really like to join you. And that can be a time for perhaps just like having conversation, like talking about feelings, a bit of offloading, stress management, getting outside. I think when something is shared, if it's an experience or even like a dietary challenge or just like making healthy changes, when someone's doing it with you, it makes it a little bit easier. And you've also got that like sense of accountability as well. So if you're doing it together, you want to show up together and you want to stick to it together as well. Um, and I guess on that note, ensuring that you have a solid support network in place. So if you're supporting someone with PCOS, whilst you want to help the other person, it's really important that as the supporter, you're being supported as well, so that you're not pouring from an empty cup. So looking at how do you get your own space in your downtime, and how do you manage your own mental health and well-being too. Um, and this slide is more like aimed at how to support people with PCOS within the workplace. So if you are on the call and this is relevant, I hope it helps. And if it's not relevant to you, your situation, you might be able to share a story with someone else. So if you are a manager and you have someone with PCOS in your team, or someone approaches you in your team and they tell you that they suffer with PCOS, how can you support them? So making the workplace like a supportive place to be is going to be really helpful. So things to think about, like, can you provide healthy snacks? So rather than, chocolate and biscuits all the time, perhaps you can get a fruit box delivery, or decaf teas and coffees, because caffeine can really interfere with hormone health and can exacerbate like menstrual pain, menstrual cramps. Um, Perhaps encouraging like education sessions on PCOS and its side effects, and perhaps not necessarily just pinpointing PCOS, but perhaps that could be part of like a broader women's health like education scheme. So you're not necessarily making people with PCOS feel like the odd one out, but actually just like a wider education on women's health in general. Modeling self-care, so making sure that you yourself are taking breaks, eating well, getting up, going for a walk, and not just sat at your desk constantly, not appearing stressed, being approachable. The environment that someone works in, because we spend so much time at work, can really impact your overall well-being. And I think this is really, really key, like allowing remote working or flexible working where possible, because you don't know if someone with PCOS gets like a just complete random period, actually having access to like sanitary products in the office, or being able to take a day like to work from home if they've got really bad menstrual cramps, can be really beneficial. And then if you're that employee that has PCOS, you don't necessarily have to tell your manager at all. But if you feel comfortable to, we'd really encourage it. I think it can really help. Or if not, perhaps talking to like someone in HR who can relay your needs to your manager in perhaps a more confidential or anonymous way. Make sure you take regular breaks. I think there's this very much pressure that you have to be seen to be starting early, like staying late in the office and working through your lunch, but actually it's not good for you, and it's not good in the long term for your overall health as well. So set an alarm for your breaks, put them in your diary as well. And then again, just prioritizing self-care. So looking at those, adding in those 5-minute mindfulness breaks to reset that nervous system, keeping on top of that stress so that you're not constantly in this stressed out state, which can really negatively impact your mood and your hormones as well. So then a little bit about us as Apricity. We talked a lot and we've just turned up on your screen, but you might not know who we are. So Apricity are the UK's first virtual fertility clinic. And that sounds complicated as well, but we work with a network of partner clinics where you can access diagnostic tests. And some of your diagnostic tests can actually be done at home as well. So we're trying to make that process much easier for you, and meaning that you're not having like long waiting times, going to clinics and lots of travel. So we can support you with diagnostic fertility tests, all the way through to having fertility treatment as well. But before any of that, we also offer complimentary one-to-one consultations with one of our fertility nursing teams. So that could be myself or one of my colleagues, Gemma or Sophie. So you can use this QR code here. So if you're way better at tech than me, but you can use this QR code, I think, and it will take you directly to the booking link. But we'll send out some booking information as well at the end too.
Absolutely, yeah. And we'll come back to the slides at the we'll come back to the QR code at the end of the slides too. So you'll have plenty of time to scan it.
Oh, great. Thank you. I'm glad you're here. Thank you. And yeah, this is just a little bit of feedback about Apricity, and our virtual care model, which is new. So like I said, we're the UK's first virtual fertility clinic, and we operate primarily through an app. And I know every company and clinic or every company has an app now, but for us, it's really just making it a huge change in the communication and support that patients get when they're going through fertility tests, diagnostics, and treatment as well. We're really happy with our patient feedback scores, 4.8 out of 5, which is amazing. So yeah, having worked in a more traditional clinic, I think as a nurse it's really nice to be able to have that constant support through the app, instant messaging, updating your treatment, appointment information. Yeah, it's a real game changer. Let's go back to these myths that we talked about at the start. So hopefully you have a bit more of a clear understanding on what PCOS involves and what it doesn't. So first one, all women with PCOS have ovarian cysts, and that's definitely not true. Sometimes the immature follicles that are higher in numbers on women with PCOS are referred to as cysts, but they're not actually cysts. That doesn't mean to say that you cannot have a larger ovarian cyst, but traditionally, no. It's not associated with having lots of cysts on the ovaries. Women with PCOS cannot have children. Again, that's not true. Some women with PCOS can conceive with no issues at all. Some women with PCOS may have difficulty with conceiving, and others may need to go on to have fertility treatment to support with them conceiving. The third myth, an irregular menstrual cycle means that you have PCOS. Not necessarily, because we know that there's lots of things that can impact irregular cycles. So if you are having irregular cycles and you haven't had any diagnostic tests, I would definitely recommend doing them, because PCOS is not the only cause of having irregular periods. So it would be good to kind of work out what is going on if you are struggling with missing or irregular periods. Myth number 4, PCOS is a rare condition. We know it's not. It's at least 1 in 10 women that are affected, and I'd say it's probably higher. And then myth number 5, losing weight will get rid of PCOS. Unfortunately not, no. There's not a definitive cure for PCOS. For some people, losing weight can alleviate or improve some of their PCOS symptoms, but not necessarily. It's not the miracle cure, I'm afraid. And these are some of the resources that we spoke about, and Sophie's going to share the links as well. So the British Dietetics Association have got a really helpful fact sheet on foods that can help people with PCOS. And then similarly, the PCOS Collective is an organization, a free organization that's run by a group of nutritionists, and they talk about all things PCOS. So it's not just nutrition, but they've got some really helpful information there. And they've got some great links to support services as well. Verity is the UK's only registered PCOS charity, and they hold online and in-person support groups. So a great resource, and they're really active in research as well. So if you do have PCOS and you want to help and be involved in some research studies as well, it's a really great thing to be involved in. And then PCOS Relief is more of a global community to support women living with PCOS. So lots of options that you can access for more information and support. And then, yeah, just a final thank you so much for joining and giving up your Thursday evening, listening to us talk on. Um, Sophie's correct. There's the QR code if you do want to book in for a free consultation with myself or one of my colleagues. But yeah, I think we're going to go through some Q&As if there's any questions as well.
Absolutely. And I'm in the Halloween spirit, it appears, because in the time in the time that
Yeah,
we started presenting, my room's gone completely dark. I've got a very orangey lamp. So
it's
thank
nice,
you.
cozy.
It is very cozy, yeah. I hadn't seen myself until just now. Um, Brill, sorry, I was just having a read through because we do have some questions. So I will ask the first one. I have very irregular periods and have had scans to show cysts that have created a rim around my ovaries. One GP told me about needing 2 out of 3 symptoms in order to be diagnosed. I went for hormone testing and have normal levels of testosterone, and therefore another GP told me I don't have PCOS, despite having pretty much had every other symptom. Is it worth trying again to get a diagnosis? What do you think to that, Debs?
Yeah, so first of all, yeah, it's difficult because everyone is individual, and that rim of cysts around the ovaries is often called a string of pearls, which sounds nicer than a rim of cysts. So I thought I'd throw out the string of pearls. So it just means that there's lots of follicles on those ovaries, and they make a little ring around like the ovary itself or within the ovary itself. I would say if you're unhappy, it's always worth getting a second opinion. I think regardless, it's always worth getting a second opinion. I don't know when that was that you had those scans and those tests, but I think if you are able to access like, through an employee benefit as well, it could be something really helpful. So yeah, I would definitely encourage some more testing, particularly if you're still struggling with irregular periods. It can be really frustrating if you've tried, lifestyle changes and they're not making a difference. Perhaps actually that's a time when medication can be really helpful. So yeah, I would definitely seek some more tests.
Brill. And then we've also got a couple of questions. One asking on diet. So what diet should vegetarians with PCOS have, preferably?
That's a good question. So I think it's really important with like anything dietary related that everyone's really different and everyone's really unique. And also I don't know if anyone else has experienced this, but you could eat the same thing like the next day and have a very different response to it. So it can be down to like stress, time of the month, what your hormones are doing, what the weather's doing, those kind of things. So um, I'm never going to say that diet is prescriptive. As a vegetarian, you're doing pretty well because there is a lot of clinical research around the Mediterranean diet and its benefits on many conditions, but PCOS is one of them that's been researched more than others. So a Mediterranean diet is already naturally like high in plant-based foods. So when we think about plant-based foods, that would be like whole grains, nuts, seeds, a real variety of like fresh fruit and veg, lentils, pulses. And actually, naturally, a Mediterranean diet is very low in meat and like animal products. So um, I would say have a look at some of the resources that we're going to send out because the PCOS Collective has got some really good information on diet. But I would say mostly avoiding like ultra processed foods as well. I know that's a bit of a buzz phrase at the minute, but actually, what the Mediterranean diet is more about is actually about eating whole foods rather than, something where you might read the ingredients and not actually know what they are. So it's about those whole grains, whole foods really that are really important. But I would say, yeah, overall, a vegetarian diet is pretty good.
Perfect. And then last question, not the last question, sorry. The last one that was sent in before the webinar was any advice, again, for someone potentially with PCOS, but just trying to conceive over 40, over the age of 40.
Yeah, it's a really good question. So I would say, regardless of whether or not you have PCOS, as we spoke about in the webinar itself, your ability to get pregnant is all about the quality of your egg cells, and that just naturally declines as we age. Um, Whether you have PCOS or not, it doesn't. Even if you're not having regular periods, that doesn't preserve your fertility as such. It doesn't preserve the egg quality. So, if you are wanting to get pregnant over the age of 40, first of all, I'd be brave and do some fertility tests, because until you know what your fertility levels are at, so that would be a blood test to look at your egg reserve levels, and also a pelvic scan to assess your ovaries and see what's going on. How many follicles have you got on those ovaries? That will help us like get an understanding, or help you to have an understanding of where your fertility levels are at, and then what the best next steps might be. So I would say it's certainly not impossible to conceive naturally over the age of 40, but I think because it is more difficult to get pregnant over the age of 40, having some diagnostic tests is going to be more empowering and maybe give you a bit more control back on a situation that might feel a little bit out of your control. So, yeah, I would definitely get some tests and then speak to a professional to get some guidance on what the best next steps might be for you.
Well, thanks, Debs. And then we've got one more question, but I might ask Debs if you get in touch with this person directly over email, if that's okay.
Yeah.
Just because some of the terminology I'm not quite sure about. So just in case it's a personal inquiry, if we cover this over email or over a call, if you're still on the call as well, we can even offer in a calendar so you can speak directly, if that's okay.
Yeah, that makes sense. Definitely.
Yeah. Perfect. If no one else has any other questions, just to say thank you again so much, as Debs has said already, for joining. I'll leave it open another few seconds just in case there's any more. But as we've said, please do book in for a call with us. You can either call directly, or I'll be sharing the links afterwards as well, not only with the Calendly link to book straight into one of our nurses' diaries, but also with the resources on as well for you to explore in a bit more detail too.